Good morning all. So previous classes we had seen regarding the newborn assessment. So in this class I am going to discuss you regarding the reflexes of the newborn. So as you know that there are different reflexes: rooting, sucking, swallowing, gagging, sneezing and coughing, extrusion, blinking, doll's eye, palmar grasp, plantar grasp, dancing or step in place, Babinski, tonic neck or fencing position, and Moro or startle reflex. First one is rooting reflex. So touching or stroking the cheek near the corner of the mouth, the baby will be turns the head on the direction of stimulation so that the neonate can find the food. That is rooting reflex. So age of disappearance is 6th week of life. Next one is sucking reflex. Stimulation to elicit reflex. So for sucking reflex, touching the lips when the nipple of breast or bottle or other object. When you touch the lips with the bottle or nipple of the breast or other objects, the baby will suck. Sucking movements that enable the newborn to take in food. That is the sucking reflex. Age of disappearance is begins to diminish at 6 months. It disappears soon after birth if not stimulated. If you are not at all doing the stimulation, it will disappear soon after the birth, and normal conditions it will last up to 6 months. Then swallowing reflex. It is accompanying the sucking reflex. After sucking, the baby will swallow. Food reaches the posterior of the mouth is swallowed. Then gagging reflex. When more is taken into the mouth, that can be successfully swallowed. Immediately return of undigested food is called gagging reflex. Whatever food the baby is taking, it is more means immediate return of the undigested food is called gagging reflex. This type of reflexes, that is swallowing and gagging reflexes, will not disappear. Then sneezing and coughing reflex. Foreign substances entering the upper or lower airway means baby will start sneezing and coughing. Clearing of the upper air passages by sneezing. Baby will sneeze and baby will clear the upper airway passage. The lower air passages baby will clear through the coughing. It also does not disappear. Then extrusion reflex. Substance placed on the anterior portion of the tongue means extrusion of the substance to prevent swallowing. Baby will put the tongue out. So extrusion of the substance to prevent swallowing, that is called extrusion reflex. Age of disappearance is about 4 months. So when you keep, baby will put the tongue out. Then blinking reflex. Exposure of eyes to bright light from a flashlight or otoscope or sudden movement of objects towards the eyes means what baby will do? Baby will rapid eyelid closure will do. That is to protect the eye. That is called blinking reflex. Then age of disappearance is it will not disappear. Then doll's eye reflex. Turn the newborn's head slowly to the right or left side. Normally the eyes will not move, only head will move and baby's eyes will be on the same side only. So if you turn the head to right side, baby's head will be on the baby's eyes will be on the left side. So if you turn the head to other side, the particular side will be baby's eyes will be. When fixation develops, what will be happening? Once you turn the head towards the right side, baby also will look to the right side. Once you turn to the left side, baby will also look towards the left side. But now we cannot expect that kind of movement or reflex from the baby. That is called doll's eye. Wherever you turn the head, the baby's eyes will be on the particular side which already baby has kept. Then palmar grasp reflex. Object placed in the newborn's palm means baby will grasp the object by closing fingers around it. Age of disappearance is 6 weeks to 3 weeks. Purposeful grasp is evident at 3 months of age. Means whenever baby something want, baby will catch. Then plantar grasp reflex, touching the sole of the foot at the base of the toes. Toes grasp around a very small object. So you can see 8 to 9 months in preparation for walking, it will disappear and sometimes may continue to be present during the sleep. So plantar grasp reflex means when you touch the sole of the foot at the base of the toe, baby will grasp using his leg fingers. Next one is dancing or step in place reflex. Hold the neonate in a vertical position with the feet touching a flat surface. That what will be happening? The rapid alternating flexion and extension of the legs as in stepping movement. So it will be disappearing around 3 to 4 weeks. The neonate soon thereafter can bear some weight on the legs without stepping. Babinski reflex, stroking the lateral aspect of the sole of the foot with a relatively sharp object or fingernail from the heel up to towards the little toe and across the foot to the big toe. That time you can see fans the toes, that is positive Babinski's reflex. The adult normally flexed the toe. The newborn's response is due to an immature level of nervous system. So in the picture you can see when we put that time what will be happening? Fanning of the toes. Fanning of the toes you can see. Age of disappearance is, so adult will be flex. The first picture you can see flexion, that is adult. For newborns fanning. Age of disappearance is 3 months of age. Then tonic neck reflex. Turning the head quickly to one side while the infant is supine position. We will turn the head quickly to one side. That time arm and leg on the side of the head is turned towards extend. Arm and leg on the opposite side will flex. Both hands may make a fist. That is called a tonic neck reflex. So in this picture you can see that is 18 to 20 weeks. Tonic neck reflex is replaced by asymmetrical positioning of both sides of the body. So around 18 to 20 weeks it will resolve. Suddenly you will turn the head of the baby. What will be happening? Arm and leg on the side of the head is turned toward the extent and arm and leg on the opposite side will reflex. Then Moro reflex. Startling the infant with a loud voice or apparent loss of support due to a change in the equilibrium. The neonate is held in a supine position above the table or bed and the nurse supports the upper back and head with one hand and the lower back with the other. The newborn's head is suddenly allowed to drop back on an inch or so. Only an inch or so you have to just drop the head. That time generalized muscular activity baby will elicit. Symmetric abduction and extension of the arms and legs with the fanning of the fingers. The thumb and index finger on each hand form a C shape. The extremities then flex and abduct. The baby may cry. So this is strong up to 2 months and it will disappear around 3 to 4 months. Then some of the special senses like touch, vision, hearing, taste and smell. So thank you. Hope you are understanding my classes. Please subscribe and share to your friends.